Let's take a look at some of the pharmacology MCQs. The first question is, what is the other name for vitamin B3? Riboflavin, pantothenic acid, nicotinic acid, pyridoxine. The correct answer would be nicotinic acid or vitamin B3. It is also known as niacin, which occurs naturally in food. Vitamin B3 is used as medicine. It can improve levels of blood fats or lipids such as cholesterol and triglycerides. It works by reducing the amount of bad cholesterol and triglycerides made by the liver. Which one of the following lymphocytes produce antibodies? B cells, T cells, macrophages, helper T cells. The correct answer is B cells. So lymphocytes are divided mainly into B and T cells, and B cells produce antibodies which recognize foreign substances or antigens and attach themselves to them. Antibody is also known as immunoglobulin. It is a Y-shaped structure. The next question is, which of the following drug is used to demonstrate the topical action on eye? Tolmetin, lignocaine, nifedipine, ketotifen. The correct answer is lignocaine, which is also known as lidocaine. It is applied in the eye to cause numbness or loss of feeling before certain procedures. It works by blocking the signals at the nerve endings in the eye. The fourth question is, sodium fluoride is used to prevent dandruff, skin problems, ulcer, dental caries. And the correct answer is dental caries. Sodium fluoride makes teeth more resistant to decay and bacteria that causes cavities, and it is used to prevent cavities. Fifth one, which of the following is an autosomal dominant disorder? Polycystic kidney disease, alkaptonuria, Wilson disease, thalassemias. And the correct answer is polycystic kidney disease. Autosomal dominant disorder means a pattern of inheritance in which an affected individual has one copy of a mutant gene and one normal gene on a pair of autosomal chromosomes. And the other examples include Huntington disease, neurofibromatosis, etc. The next question is, emitin, an alkaloid of ipecacuanha, act as antidiarrheal, antiseptic, amebicide, antimalarial. And the correct answer is emitin is used for the treatment of amebiasis and is a major component of ipecac syrup. The seventh question, which of the following drug is used to demonstrate the mydriatic action? Chlorambucil, procaine, and fluorouracil, atropine sulfate. And the correct answer is atropine sulfate. A mydriatic is an agent that induces dilation of pupil. Atropine is commonly classified as an anticholinergic agent. Topical atropine is used as cycloplegic to temporarily paralyze the accommodation reflex and as a mydriatic to dilate the pupils. The eighth question is, which one among the following has high glycemic index? Vegetables, syrupy foods, whole grains, brown rice. It is pretty much easy, right? Syrupy foods has high glycemic index, obviously. These types of foods are digested and absorbed quickly and therefore a rapid rise in blood sugar levels. These foods are high in processed carbohydrates and sugars. and they are categorized according to the GI scale, whether low, medium, or high GI or glycemic index. Ninth question is BCG vaccine is a bovine strain of Mycobacterium tuberculosis, Salmonella typhi, hepatitis virus, parainfluenza virus. So the correct answer is Mycobacterium tuberculosis. BCG is prepared from a strain of attenuated live bovine tuberculosis bacillus. Now moving on to the 10th question. Angioedema is the ADR affecting the skin, pancreas, liver, GIT. So angioedema is the rapid edema or swelling of the area beneath the skin or mucosa. So skin is the right answer. It is normally an allergic reaction, but it can also be hereditary. The swelling happens because fluid accumulates. It tends to affect areas with loose areas of tissue, especially the face and throat, as well as the limbs and genitals. And the 11th question is, aspirin should be used with caution in asthma, fever, headache, tachycardia. The right answer is asthma. When medications such as NSAIDs or aspirin block the cyclooxygenase 1 enzyme, production of thromboxane and some anti-inflammatory prostaglandins is decreased. And in patients with aspirin-induced asthma, this results in the overproduction of pro-inflammatory leukotrienes, which can cause severe exacerbations of asthma. The next question is smallpox vaccine is a bacterial vaccine, antiserum, viral vaccine, toxoid. The correct answer is it is a viral vaccine. The vaccine is made from a virus called vaccinia, which is a pox virus similar to smallpox but less harmful. The smallpox vaccine contains live vaccinia virus, not a killed or weakened virus like many other vaccines. Calcitonin is secreted by adrenals, thyroid, parathyroid, or thymus. It is secreted by the thyroid gland. Calcitonin is a hormone that is produced in humans by the parafollicular cells, commonly known as C cells of the thyroid gland. Calcitonin is involved in helping to regulate levels of calcium and phosphate in the blood. Okay, now moving on to the next question. Estimation of serum creatinine is considered to be a more reliable indicator for the evaluation of lung function, liver function, kidney function, or gastric function. Creatinine is found in serum, plasma, and urine and is excreted by glomerular filtration at a constant rate and in the same concentration as in plasma. So it is used for the evaluation of kidney function. Creatinine is a more reliable indicator of renal function than BUN or blood urea nitrogen because it is less influenced by other factors such as diet and hydration. Now moving on to the last question. Astrocytes are present in blood-brain barrier, blood-CSF barrier, cell membrane barrier, blood-placental barrier. The correct answer is blood-brain barrier. Astrocytes are the star-shaped glial cells that reside in brain and spinal cord. They are the most numerous cells in the human brain, performing many tasks.